Hello, everyone. Hope everyone is doing well. My topic and what I will be presenting on today is acute stress disorder. So, acute stress disorder, also known as psychological shock, is a stress disorder. Is a mental disorder that describes a person's response to a traumatic event. Um, Acute stress disorder can last anywhere from the moments after the traumatic event happened up until a month. After that month, then it becomes classified as PTSD. So some of the symptoms of ASD are nightmares, flashbacks, intrusive thoughts and memories, some anxiety, some sleep disturbance. Some physical symptoms would be heart palpitations, nausea, chest pains, headaches, breathing difficulties, and stomach pains. Uh, ASD affects anywhere between 5 to 33% of a population. And when broken down between the types of trauma, it is different percentages. I believe 59% for rape, 59% of ASD victims suffer or have been traumatized by rape. Brain injuries, I believe, is about 14%. And I'm saying I believe, but I do have notes here. So that is the prevalence. A ASD can become very problematic for a person or families because it's trauma. Trauma affects yourself and everyone around you. Um, it can alter the way you go throughout your day. It can alter and affect the way you do your job or interact socially. With your family, depending on what the trauma could be. It could cause you to isolate yourself or even overcompensate in some situations, depending on the type of trauma. For example, uh, a severe car accident can cause someone to not want to get in a car. Um, and that would kind of affect the way you interact with your family if you can't get in a car or go anywhere with them, or if you wanted to visit. Some people have trauma based on plane crashes, and can't go see their families because they would have to get on a plane. So in those situations, it can affect the person. If they're having heart palpitations and chest pain in the middle of work or going having anxiety attacks, obviously it can affect the way that you do your job. So when we did our interventions last week, my interventions, so it is worth mentioning that the most used treatment for ASD or acute stress disorder, the most used treatment is CBT. But because we can't really discuss that for this particular assignment, because we can't use this for this particular assignment, I mostly didn't really show my I can link it, and I probably will. I'll put it in the link with the video on YouTube. But it's mostly CBTs and pharmacology that's used for a acute stress disorder. So I just showed a little snippet here, um, and I will just be discussing one of the interventions. So one of the interventions is exposure therapy. It's a psychological treatment that helps people confront their fears in a safe environment. This intervention was used, or the some of the uh, individuals that studied this using randomized trials was Sadie Larson, Joshua Hunt, Caitlin Herman, Nicholas Schumann, and what they did was they focused on how to use prolonged exposure therapy to treat people with acute stress disorder. So what they did was they went into hospitals and they were pulling um, patients from the hospitals as they came in, different, and they kind of randomized that in a way that it wasn't all one type of trauma. It wasn't just car accidents or people of rape or someone that had a brain injury. They kind of pulled from different areas in a hospital. And what they did was they had the people sign up for therapy outside of the hospital where they would come to do 60-minute sessions, a minimal of 3 60-minute sessions where they were first they went through their traumas, typical intake stuff. But by the third one, how they exposed them was they gave them headphones to kind of play an imaginary scenario about their trauma, um, in different increments to see if that would help them deal with their trauma and address their symptoms and fears around it. That was not that successful. However, I do believe because exposure therapy is a type of CBT that it can be very helpful but they may just have to modify the way they expose the trauma or the scenario to the patients. Um, Exposure therapy is used in many other things, such as PTSD, such as people with phobias, and it can be very effective and has been very effective. So I do believe that exposure therapy is a great way to um, address acute stress disorder. I guess it just depends on the methodology and how you provide that service to an individual that's been uh, recently traumatized. So, the next intervention that I will discuss is psychological first aid, which is a technique designed to reduce the occurrence of post traumatic stress disorder. It was developed by the National Center for Post Traumatic Stress Disorder, which again is the big sister to acute stress disorder. Um, that's a section of the United States Veteran Affairs, and this was developed in 2006. Psychological first aid. Let me pull up my notes here. So, psychological first aid, if you know you've worked in the field long enough, you know what it is. But the components of it are active listening, reassurance through normalization, provision of appropriate and supportive advice and information, providing resources, helping people to identify the problems they cannot handle, modeling, to model helpful reactions to a traumatic event, specific attention to the needs of children, young people, and other specific groups, considering and addressing ethical matters, and evaluating risks. There are some other things, but they kind of bleed all into each other. And essentially, what that is instead of doing the cognitive behavioral therapy, what they do is it's more of like a group, like a support group, where you get the resources that will help to support you. They kind of normalize what you've been through and kind of help you uh, come up with ways to deal with the problem yourself instead of having to go through therapy. Um, and a number of other ways, these people are trained professionals that help you through this using psychological first aid. But that intervention with this intervention, it has not been empirically shown to be very effective, but it is an evidence informed approach, which has been working for decades, and how they assist people through their traumas. So, in summary, acute. So, in summary, ASD or acute stress disorder um, has a lot of research behind it simply because post traumatic stress disorder is something that is very researched and has a lot of evidence based interventions and treatments and ways to support people. However, acute stress disorder itself, the research behind it needs a little work. The methodology needs a little work, and it's more so surrounding PTSD instead of ASD, um, which can be helpful, except for the fact that um, acute stress disorder is kind of the precursor. So it makes sense to find more research to address ASD before it gets to PTSD. Um, so I think that's where the research kind of falls short. With it's mostly surrounding PTSD and how to support that disorder instead of ASD. Um, I will say that again, the main treatment for this is shoot. Oh, I'm out of time. The main treatment for this is CBTs, which is widely researched. So all they have to do is kind of tweak it to adjust for this disorder. Thank you for your time. Have a great day.